So you're reaching out about your teen's eating disorder. We're so glad you're reaching out to get more information and to support your teen. You may find that what you think you know about eating disorders is very outdated. Much of what we know about eating disorders has changed in the last 20 years. And so it's important to get accurate, up-to-date information. The treatments we provide at Eating Disorder Therapy LA are all evidence-based treatments. This means they are treatments that have been researched and proven effective in clinical trials. The treatments that we provide are cognitive behavioral therapy for adults, family-based treatment for adolescents with active eating disorders, and cognitive behavioral therapy for ARFID for people 10 and up with ARFID. At Eating Disorder Therapy LA, the only treatment we provide for teens with active eating disorders is family-based treatment. This is sometimes also referred to as FBT or the Maudsley method. It's not traditional family therapy as often seen in other contexts. It's a very specific behavioral treatment focused on eradicating your teen's eating disorder. This treatment requires parents to play an active and involved role in treatment. FBT has 3 phases. In the first phase, parents are responsible for planning, preparing, serving, and supervising all meals for their teen with an eating disorder. This amount of supervision is required in order to nourish a teen with an eating disorder back to health and to challenge all eating disorder behaviors, whether it's restriction, overexercise, purging, or other compensatory behaviors. This treatment requires parents to be attending sessions. It also requires weights prior to every session. You can do this either at home if you have a scale, or we can do it in our office, or you can take your teen to a doctor weekly. We also require releases of information so we can consult with everyone else who's involved in supporting your teen, medical doctors and other providers. We do not provide individual therapy to teens with active eating disorders because we find that family-based treatment, which again is an evidence-based treatment, is so much more effective and works faster. So if you want to work with us for your teen's eating disorder, we do require weekly appointments with the teen and parents in attendance, and we require the releases and regular weights. You may ask whether your teen wants to proceed with such treatment. Most teens, when given the choice, will not choose family-based treatment. It's a treatment that directly confronts the eating disorder. So when your teen has an eating disorder, it's kind of like they're under the spell or the clutches of this monster that's come and taken over them. And family-based treatment is one of the most effective ways to eradicate this monster, to extricate your teen from the monster. And it does so by requiring parents to challenge the eating disorder when their teen can't do it for themselves. And you can do this in the most loving and compassionate way, but it does require firmness and persistence on the part of parents. We do not provide individual therapy to teens with active eating disorders.